Good evening aspirants, welcome to Crack Grade B to another session of PIB MCQs for Phase 2 NABARD. First of all, please clarify whether am I audible and visible and screen is clearly visible. Yes, Rohan, I have checked your query, everything is fine from our side. Please look into your settings of YouTube. Am I audible, guys? Please clarify once. Yes, ma'am. Yes. Hello. Good evening, everyone. Yes. Let's start the session. Okay, so in the last class we have covered till amnesty scheme, right? We have to start amnesty scheme. So amnesty scheme is basically introduced so that the demand for tax for any SSC is there so that they can file an appeal against that. The reply should be given in 3 months, okay? See. Within 3 months of the tax officer passing such a demand order, this can be extended by 1 more month. So this has been changed now. The appeal can be filed now till 31st January 2024. This is the major change in amnesty scheme, and the entities willing to avail this scheme will have to pre-deposit the tax to 12.5%, that was 10% earlier, okay? So this percentage is also changed there. Before it was 10% and now it has been changed to 12.5%, okay? And the date for filing appeal is 31st January 2024 now, okay? Okay, now some additional information about sugarcane. Why I have included sugarcane, right, in this GST council? Because there is a reduction in molasses GST, that is to how much percentage molasses has been taxed in under GST? Please participate in the session, else it will be very monotonous for you as well as for me. 5. Okay, let me Let me remind you again of the GST changes, that is on molasses from 28% to 5%. There is an request to keep the extra neutral alcohol outside the purview of GST, and for pre-packaged bajra it is 0% and after packaging and labeling it is 5%, right? Got now? These are the major changes. And for converting job services, for converting barley to malt, it is 5% GST, right? So molasses basically comes from sugarcane, okay? And recently the export duty on molasses export is increased there, okay? So molasses become very important, from where it comes and what is the purpose of molasses, and therefore sugarcane is very important. And this is the in 122 years, this month in August, that is August 2023, was the driest year if we consider the rainfall. So it hampered the sugarcane manufacturing, sugarcane productivity. Okay, so some details about the sugarcane revision for static. Scientific name is Saccharum officinarum L. This is from grass family. You have to remember family. Okay. Temperature is 21 to 27 degrees Celsius. Rainfall is 75 to 100, and soil is dip rich loamy soil. So for sugarcane production, a scheme for extending financial assistance to sugar undertaking, SEFASU, was introduced by government earlier. Okay, and other, that is fair and remunerative price for sugarcane. Now how fair and remunerative price for sugarcane decided by which department? Okay, that we have to look into, and what is the process of deciding the rate. So the central government announces fair and remunerative prices, which are determined on the recommendation of Commission for Agriculture Cost and Prices. That is, recommendation is given by CACP, and the final price is announced by Cabinet Committee on Economic Affairs. Okay, and the current fair and remunerative prices is rupees 315. Okay, everything is clear till now? A committee was set up in 2012 to give recommendation on regulation of sugar industry. Okay, there were two recommendations given by the committee mainly, that is abolition of quantitative control on export and import of sugar, and the committee also recommended that no more outright bans on sugar export. Okay, the radial distance between any two sugar mill is 15 kilometer. That is, the distance two sugar mills should be 15 kilometer away from each other. That is the guideline by the central government, and FRP at present for 2023-24 is 315 per quintal, not per kg. Okay, per quintal. Further, FRP for ensuring sugar season 2023-24 has been fixed at this 315 per quintal, linked to a basic recovery rate of 10.25%, subject to a premium rupees 3.07 per quintal for 0.1% increase. So what this basically means, let's understand that. So it is basically saying, first of all, what is recovery rate of sugarcane? Recovery rate means that if there is 100 kg of sugarcane and 10 kg of sugar can be extracted from 100 kg of sugarcane. Okay, from 100 kg of sugarcane, 10 kg sugar can be extracted. This is called recovery rate. So here recovery rate is 10%. Okay, 10 kg sugar from 100 kg sugarcane into 100, that is 10%. This is what we call recovery rate. So it is saying that for every 0.1% increase in recovery rate, a premium, that is additional amount of 3.07% has to be paid. Okay, and above 10.25%, reduction in FRP at the same rate for every 0.1% decrease till 9.5. So for every 0.1% decrease in recovery rate, there is an decrease in the rate till 9.5. This is the lowest limit. Okay, till 9.5% it can be decreased. Moving on to the next question. Question number 18. Please read the question and answer this. ensure the quality of education to school students in Indian Ministry of Social Justice and Empowerment launched dash under the scheme. Around 3000 SC students with parents' annual income up to dash are selected annually based on their merit. The progress of these students will be continuously monitored by Ministry of dash. Have you read the question? Let's move on to the option. Yes, Shrestha scheme. Right, this is Shrestha scheme. Now next question. What is the family income limit under Shrestha scheme? What is the income limit? 2.5, 3.5, 4.5 or 2 lakh? It is 2.5 lakh, okay? The income is 2.5 lakh per annum for the family. Then they are eligible. Now the continuous monitoring of the students under this scheme will be done by which ministry? Ministry of Education, Ministry of Social Justice and Empowerment, Women and Child Development Ministry, or none of the above? And it is done by NTA. Which ministry will monitor the progress of the students in the Shrestha scheme? It is Ministry of Education, okay? Now let's read about the Shrestha scheme. The scheme for residential education for students in targeted areas. This is the full form. This has been formulated with the objective to provide the quality education to the SC students and bring them at par with other students, okay? And objective is to provide access to quality education. Eligibility is that family income should be up to 2.5 lakh per annum and at free of cost from 9 to class 12 will be provided. Now there is NETS, that is National Eligibility Test for Shrestha. Students will have to appear this test so that they can become eligible for the scheme. This is conducted by NTA. And which schools are eligible for Shrestha scheme? The ministry, through a committee with representative of Ministry of Education and CBSE and Finance Division of the department, has selected best performing private residential school affiliated with CBSE. Now what are the parameters? These are the parameters. First, the school should be in existence for at least 5 years, and in class 10th and 12th board, the result of the school should be above 75%, okay, in last 3 years. And the school have adequate infrastructure for admitting additional at SC students in class 9th and 11th. Now what is the scholarship amount that is being awarded? For 9th class it is 1 lakh, for 10th class it is 1.10 lakh, and for class 11 1.25, and for class 12 it is 1.35, okay. Now the scholarship will be released in one installment. It will be released in only one installment directly to the schools in first quarter of every financial year. And the progress of these students under the scheme will be constantly monitored by Ministry of Education. Now there is a course called Bridge Course under the scheme. So the bridge course is of time duration of 3 months. This is basically outside the school hours. It will be provided training and other education related skills to the students to make them at par with the other students, okay. So basically to make them adapt the new environment of the other school, the bridge course has been provided for the students. Now the bridge course should be conducted outside the school hours, and additional cost is 10% of the annual charge. Clear? Now one case study for you. Please answer the question. Rahul has heard about the Shrestha scheme from his parents in 2010. He passed class 8 in 2010 and want to take admission in class 9 in 2012. The annual income of his parents is rupees 2.5 lakh and he was not covered under any other scheme. Okay. Rahul took the gap because he had no money for the continuation of his education for class 9. So he decided to give a gap of 1 year, and his school in class 8 was local body school near his home. Is he eligible for the scheme? If not, why? Yes, he is eligible because there is no mention of gap year in the guidelines of Shrestha scheme. Yes, he is eligible in every case. He is eligible. No, because he didn't pass class 8 in the immediately preceding year of the admission. And option D says that no, he is not eligible because he didn't study in local body, because he studied in local body school and not in central government school and state government school. Anukul is saying A. What about others? Have you understood the question? At least give answers. Even if you are giving wrong answers, doesn't matter. You will remember it most. No, Anukul, 75% is the percentage required for the school in class 10th and 12th board. That is, the result of school should be above 75% in board classes in last 3 years. Okay. Okay. So nobody is giving answer of this question. He is not eligible because he didn't pass class 8 in the immediately preceding year of the admission. See, he passed class 8 in 2010 and he wanted to take admission in class 9 in 2012. So there is a gap of 2011 and he is taking admission in 2012. So as per the guidelines of Shrestha scheme, any student can take admission in class 9 or class 11 if they have passed class 8th and class 10th in the immediately preceding year. That is, he should have passed class 8 in 2011. Only then he can take admission in class 9 in 2012. Got this point? Clear? There are guidelines for eligibility of selection of student. First, he have to, these are the basic requirements. First is that only SC students studying in recognized school, whether private, government or local body school, doesn't matter, it should be recognized school. Okay. For admission in class 9, the student should have passed in class 8 in the academic year immediately preceding the year of admission. So if anybody want to take admission in 2024 for class 9, he should have passed class 8 in 2023, that is immediately preceding year. Okay. Third guideline is that is same as second. For admission in class 11, the student should have passed the class 10th in the academic year immediately preceding the year of admission. And fourth is that the student applying under the scheme should not be covered under pre-matric scholarship scheme of the department. Okay, he should not have appeared for the pre-matric scholarship scheme. Only then he can be eligible. Coming on to question number 20. Please read the question and answer the first. Only Anukul is answering. What about others? They are not understanding the question or the explanation of the question. You will learn only when you will participate in the session. Else no use sitting idle and just watching the video. Okay, second question, answer this one. Again look at the question for option B. A special high panel discussion was there on scaling up the integration of non-communicable diseases in which sector? Primary, tertiary, secondary, none of the above, or any specialized sector is made. Yes. So the World Health Summit 2023 took place from 15th to 17th of October under the theme A Defining Year for Global Health Action. This was held in Berlin, Germany, and India firmly emphasizes the need for a comprehensive strategy which includes preventive measures, early discussions, and efficient management with the aim of reducing the prevalence and impact of non-communicable disease on the well-being of our citizens. So basically our government has launched various initiatives to tackle the non-communicable disease currently also and in the past also. Starting from 2010 onwards, government is continuously taking actions for spreading awareness and dealing and tackling with the non-communicable diseases. Okay, so non-communicable disease is a long duration disease and it doesn't spread from person to person. So in our guidelines, the main non-communicable diseases are cardiovascular disease, okay, and respiratory disease, cancer and diabetes. And this is for the first time in the budget 2023-24 that outcomes like hypertension and diabetes are included as outcome indicators. That is what they can work as an indicator for telling the health of the citizens of the country. Okay, so India has also launched the 75-25 initiative. This is what now? This is a screening and providing standard of care for 75 million individuals with hypertension and diabetes by 2025. The outcome budget document of the 2023-24 is noteworthy for including hypertension and diabetes treatment as output indicator. Okay, for the first time these two will work as output indicators. What are the other initiatives by India for reducing the impact of non-communicable diseases? 75-25 initiative that I have already explained. Now NP-NCD program that was launched in 2010 under National Health Mission, okay, and primary focus on strengthening the infrastructure, human resource development, health promotion, early diagnosis and management and referral, okay. And also e-Sanjeevani was launched by the government, that is telemedicine service. There are two components under e-Sanjeevani. That one, the communication can be made from the home by the individual patient, or it can be done from any primary health care, hospital, clinic and other departments. Okay, so Ayushman Bharat Digital Health Mission, it has been integrated under ABDM, and the users would also be able to share their health records with doctors on e-Sanjeevani, leading to better clinical decision making and ensuring the continuum of care. Okay, now let's revise about National Health Mission. Encompasses two submissions. Okay, two submissions, National Rural Health Mission and National Urban Health Mission. The main aim of this mission is to include health system strengthening, reproductive, maternal, neonatal, child and adolescent health and communicable and non-communicable diseases. Target of 2025. This is very important. Now National Health Mission has set up a target that needs to be achieved till 2025. Now what are these targets? First is to reduce maternal mortality rate to 90 from 113, okay, maternal mortality rate, and reduce infant mortality rate to 23 from current 32. Okay. Third is to reduce the total fertility rate to 2.1 and prevention and reduction of anemia in women with age group 15 to 49. You have to remember this age group, okay, that is targeted, and ending the tuberculosis by 2025. Reduce the under 5 mortality rate to 23 from 36, okay. Reduce the prevalence of leprosy to less than 1 per 10,000 population and incidence to 0 in all districts. Next is annual malaria incidence to be reduced to be less than 1 per 1,000 population and less than 1% microfilaria prevalence in all districts, okay. And elimination, this is very important because it was in news continuously. Elimination of Kala Azar. Kala Azar is caused by basically a sand fly bite, and it is a tropical disease basically found in tropical and subtropical regions. So the target of India is to eliminate it by 2023, way ahead of WHO's target of eliminating 2030, okay. So target of WHO is 2030 and target of India is to eliminate Kala Azar by 2023. Now the Ministry of Finance on 1st February 2022 has further accorded the approval for continuation of National Health Mission from 1st April 2021 to 31st March 2026. This is also very important point. Now National Health Policy 2017, the target for non-communicable disease is to reduce premature mortality from cardiovascular disease, cancer, diabetes and chronic, that is all major top four non-communicable disease, to reduce by 25% by 2025. This is the target of National Health Policy 2017, okay. Now if you look at the status of India, the major deaths, approximately 60% out of the total death is due to non-communicable disease, and in these diseases the list is topped by cardiovascular disease, that includes heart attack and strokes. Second is respiratory disease like asthma and pulmonary disease. This is the second reason in non-communicable disease, that is at the top 2. The 3 is cancer and 4th is diabetes, okay. Yes. So under the initiative, the screening of people with age 30 years or more will be done by the government, and screening of these common NCDs will be done as part of service delivery under Ayushman Bharat, okay. This is what I have told you, that cardiovascular is at top. Second is chronic respiratory, that is of 22%, cancer 12% and diabetes 3%. Now there is a portal, National NCD portal, and this portal will work as a platform that will provide all the information about the patient and about the control, prevention and management of NCD, okay. Next question. This year Ayurveda Day will be celebrated in about 100 countries on the theme dash: Ayurveda for farmers, Ayurveda for world, Ayurveda for one health, Ayurveda for women, or Ayurveda for all. Identify the correct theme. This is very important, okay, because this is for the first time that Ayurveda Day is celebrated on an international level, okay. So this is Ayurveda for one health. Ayurveda for One Health, it will be celebrated on 10th of November 2023 by Ministry of Ayush, and 3 focus points are there of the government, that is Ayurveda for students, Ayurveda for farmers. This is very important. This focus is on Ayurveda for students, Ayurveda for farmers and Ayurveda for public health, with the message that Ayurveda for everyone and every day. Okay. Student, farmers and public health. Next question. Question number 22. $511 Gramin Kaushalya Vikas Kendras are launched in Dash by PM in 34 districts. Okay, and each Kendra will train about 100 youngsters in at least 2 vocational courses. This was launched in Maharashtra. Okay. So training is provided by panel industry partners and agencies under NSDC, that is National Skill Development Council, and PM Modi said that from these skill development centers in Maharashtra, it would be advisable to train some soft skills for the youth who can try opportunities for going abroad. Okay, opportunities for abroad. Next question. Recently, employee state insurance scheme benefits have been extended to Dash transgender employees in August 2023. What number of transgenders? 70, 75, 85, 80 benefits have been extended under ESI scheme. No idea? What about others? So it is 75. Now recently ESI scheme benefits have been extended to 75 transgenders in August 2023. So this basically shows what, that ESI is delivering the benefits of social security without any discrimination in the gender and on any basis. Okay, so it is providing social security scheme to males, females as well as transgenders also. Okay, so it is trying to reach every section of the society. Every section of the society. Okay, let's read about ESI recent data. So benefits of ESI has been extended to 75 transgender employees. Approximately 19 lakh new workers are enrolled under the scheme. 9.2 lakh are among the age group of 25 years. Okay, to constitute new registration. Further, up to 25 years of age constitute 47% of enrollment. Okay, just remember approximately 47% of enrollment. Okay, 3 lakhs are approximately 3.7 lakh are female employees enrolled in ESI, and Employee State Insurance Act 1948 by Parliament was the first major legislation on social security for workers in independent India, and Employee State Insurance Corporation is one of the 2 main statutory social security organization under which Ministry of Labour and Employment. Okay, and other is Employees Provident Fund Organization. So these 2 are working for providing social security under Ministry of Labour and Employment. and this was stipulated in the ESI Act 1948. So just background about the ESI. Now very important topic, IMI, Intensified Mission Indradhanush. Okay, so this is the question. Please read the question and answer it. Kiran, you have joined late. We are on question number 24 right now. Please come to the question number 24. You can look the rest class later. This is a very important question. There should be no room for confusion in such questions for phase 2 especially. Anukul, please revise. So the focus of Intensified Mission Indradhanush 5.0 is on improvement of measles and rubella vaccination coverage. Okay. These other 4 are the focus area of IMI 1, 2, 3 and 4. For IMI 5, this is the focus area. Let's look at the details. Special focus on improvement of measles and rubella vaccination. IMI 5.0 is being conducted across all the districts and includes children up to 5 years of age, and this has been done for the first time. That children up to the age of 5 years has been included. Earlier children up to the age of 2 years were there. Okay, a total of 5.6 crore children, just remember approximately. Okay, approximately 5 crore children and 1.25 crore pregnant women have been cumulatively vaccinated till date under IMI since 2014. Okay, and this is for the first time that campaign is conducted in all the districts. This is one, that it is the first time that campaign is conducted in all the districts and includes children up to the age of 5 years, which was previously up to the age of 2 years. So 2 new things have been introduced in IMI 5, and immunization coverage of all vaccines under the Universal Immunization Program as per National Immunization Schedule. So all the vaccination will be done as per the National Immunization Schedule in Universal Immunization Program. Okay, in IMI 5. So it basically provides these are under UIP and these are the disease protected by vaccination. There are 12 diseases. Okay, so you don't have to remember this, but at least go through these diseases once, that what are the diseases covered under UIP. Now if we talk about the current status, the aim is elimination of rubella and measles by 2023. Okay, and use of UWIN digital platform for routine immunization in pilot mode. So UWIN digital platform is based on the guidelines of COVID-19 vaccination platform, COVIN. Okay, and it contains the information of all the vaccination, and a digital certificate is provided to the parents of the child immediately after the vaccination. Okay, earlier it was done manually. The states have concluded first round and second round currently, and they plan to conduct third round in month of November 2023. Okay, so soon third round will also be covered, and I will update you in PIB. Since 2014, 11 phases of IMI. This is also important, that currently 12th phase is going on of IMI. A total of 5 crore children and 1.25 crore pregnant women. This has already been done. So this is the 12th phase of the IMI. Now let's read about the Universal Immunization Program. Introduced in 1978 as expanded program of immunization by Ministry of Health and Family Welfare, later modified as Universal Immunization Program, and this provide the vaccination against 12 vaccine preventable diseases. Okay, so how many diseases are covered? 12. This is the 12 diseases and 12th phase is going on. Okay, 12 diseases are covered and 12 phases going on. Intensified Mission Indradhanush launched in October 2017. So focus area you should know about all IMI. For IMI 1, the focus area is on the urban areas more. Okay. In IMI 2.0, nationwide drive to mark the 25th anniversary of Pulse Polio program. IMI 3 was launched in 2021 and the focus area is on the children and pregnant women who missed their vaccination in COVID-19. And IMI 4.0, that routine immunization services reach unvaccinated and partially vaccinated children and pregnant women, and children up to 2 years of age will be covered in this drive. That was in 4.0. In 5.0, children up to 5 years of age will be covered. Okay. Next question. Please read the question. So this paragraph is talking about the global hunger index, and the global hunger index score is calculated on a 100-point basis scale, okay, reflecting the severity of hunger. Next question. Question number B. How many indicators are there in global hunger index score calculation? Yes, 4 indicators are there. Next question. India ranked above which of the following neighboring countries? Pakistan, Bangladesh, Nepal, Sri Lanka, or none of the above? What about Kiran? India is below all these neighboring countries. Okay, so India is lowest in neighboring countries. Pakistan is also ranked above India. Bangladesh is also above India. Nepal is also above India, and Sri Lanka is also above India. Okay, in ranking. Next, the GHI score of India is what? 28.7, 28.6, 28.5, 28.4 or 28.3? Yes, Anukul, it is below Pakistan also. That's why a debate was also going on in the news that Indian government said that the method of calculation is maleficious and intent are not good, and government was debating that the method of calculating GHI score is not appropriate, and the score and ranking of India is not accurately given. Okay, Yes, 28.7. Which among the following is not among the top ranked countries? Belarus, Bosnia, Herzegovina, Chile and Madagascar. Yes, Madagascar. Okay. The rank of India is 111th out of how many countries? 123, 122, 121, 125 or 132? Yes, good Ankur. So let's read about the details of Global Hunger Index. So this report is published by Concern Worldwide and Wealth Hunger, okay? Concern Worldwide and Wealth Hunger, okay? The GHI score is calculated on a 100-point scale. The 0 is considered as worst score and 0 is considered as best score, 0 is considered as best score and 100 is the worst score, okay? 0 implies no hunger. In Global Hunger Index 2023, India ranked 111th out of 125 countries, indicating a serious level of hunger. So it can be asked that India is facing what level of hunger as per Global Hunger Index report. So it is under the category of serious level of hunger. Neighboring countries such as Pakistan, which has been ranked 102, Bangladesh 81st, Nepal 69th and Sri Lanka 68th, scored better than India. And each country's GHI score is calculated based on formula that combines the 4 indicators. So there are 4 indicators. What are these? These are undernourishment, stunting, child wasting and fourth is what? Undernourishment, that not enough calories taken by the children of the country. Child stunting, that the height of child is not above the average or up to the average height, that should be at the particular age. And child wasting is the weight is below the average weight, that is considered accurate. So, and child mortality, the share of children who die before the age of 5, okay. These are the 4 indicators. Now what is the status of India? So India was saying basically on the international platform that the method of calculating GHI score for India by the Wealth Hunger is not appropriate and there is mismatch between the data provided by National Family Health Survey of India and the data provided by Global Hunger Index, okay. So that's why it was in news. As per GHI, the score is 28.7. Serious hunger is there. This shows a slight improvement from GHI 2015. In 2015, the score was 29.2. Child stunting is prevalent at 35.5 as per India's National Family Health Survey. And the prevalence of undernourishment is 16.6 as per State of Food Security and Nutrition in the World Report 2023. And India's child wasting rate is concerning 18.7 as per India's National Family Health Survey 2019-21, India's highest among the all countries in the report. And under 5 mortality rate is 3.1%, okay. And as per GHI, these are the top countries, that is Belarus, Bosnia and Herzegovina, Chile, China, and the lowest bottom countries are Madagascar, Central African Republic and Yemen, okay. The GHI score for world is 18.3, which is in the category of moderate. India is in serious category and the country in the world is in moderate category with a score of 18.3. Prevalence of undernourishment has risen from 572 to approximately 735 since 2017, okay. The major reason for such score is the climate change, Russia-Ukraine war, COVID-19 pandemic after effects, okay, and criticism of methodology is also there by Indian government. The Ministry of Women and Child Development has raised concern about the report's methodology, suggesting serious methodological issues and malified intent, okay. And the date, because why? Because there is mismatch between the data that is available on the government's portion tracker consistently shows child wasting below 7.2 and GHI is showing the child wasting at 18.7%. The percentage of child wasting as seen in portion tracker has been consistently below 7.2, okay, on month basis. Now last question. Under Pradhan Mantri Garib Kalyan Anna Yojana, Gramin Kalyan Anna Yojana, Garib Kalyan Anna Yojana, the quantity of dal of each person is, I am asking about the quantity of dal, okay. Under Pradhan Mantri Garib Kalyan Anna Yojana. It is 2 kg, 3 kg, 4 kg, 1 kg or 2.5 kg. Yes, it is 1 kg, okay. 5 kg or wheat or rice and 1 kg dal, okay, is provided. Some detail about Garib Kalyan Anna Yojana. The nodal ministry is Ministry of Finance, okay, and the scheme run under the Department of Food and Public Distribution under Ministry of Consumer Affairs, Food and Public Distribution. Now it provides 5 kg of rice or wheat according to regional dietary preferences per person and 1 kg of dal to each family holding, okay, ration card, as per ration card, okay. And the scheme will end on 31st of December 2023, and recently, that is a day before, it was proposed to extend the Garib Kalyan Anna Yojana scheme for next 5 years, okay, that is till December 2028, okay. Everything is clear? Any doubt till here? This was the last question. Okay, now so I wind up here, okay, and next questions of PIB MCQs and PIB will do tomorrow and day after tomorrow, okay. Do continue your preparation. I hope you all cleared phase 1 of NABARD. Don't waste time and keep on revising the schemes PIB, ESI and ARD, okay. All the best for phase 2 preparation, okay. And please consistently attend the PIB specially, because it will help you in your descriptive as well as your objective, and mostly questions are from either schemes or PIB, right? Whether it is 1 mark, 2 mark, mostly questions are from these only. And I am trying to cover static part also through PIB, like sugar cane and scientific name and every property of the crop, okay, that is in news. Okay, so there is a homework for you. Please write the scientific name of lemon in the comment box. This is the homework, okay. Please remember the scientific name of lemon. Lemon and its family name. I will daily give you one homework question, okay? This is homework question. You write the scientific name of lemon and its family, okay? Okay, please do like the session if you learned anything today. Okay, thank you. Take care.